All right, class, this is going to be a relatively short presentation today, and I'm going to kind of rapid fire through some stuff related to public health and anthropology, specifically medical anthropology, because that's basically where the intersection is most clear and evident. But also, this is going to cover some more on your reflection paper and your intervention paper guidelines. Basically, it's giving you a presentation on them so you have a clear understanding of what I'm really looking for these two separate papers. So as a brief overview of public health and anthropology, you've probably heard public health mentioned a lot because of COVID as an example. Both disciplines have a long history of kind of butting heads, but also kind of playing nicely sometimes with each other. And there are very kind of ingrained reasons for this that may not necessarily reflect, let's say, contemporary practice, but it also, in some senses, still does. As an example, public health generally in its history has been a very quantitative discipline, and it still kind of is today. However, they're starting to kind of be more comfortable with qualitative methods. Anthropology kind of has been on the inverse of that. Their history largely, excluding, let's say, archaeology as an example, or forensic anthropology, so I'm kind of focusing on cultural and medical, has largely been a discipline looking at qualitative, so that sort of emic, that local understanding in terms of what they consider to be quality data. Now, public health, as an example, sort of getting into how there's some tension there potentially, often critiques anthropology for, let's say, having a small sample size, for not being generalizable, which means, like, for instance, okay, you interviewed 30 people. What does that really tell you about the country of Belize, as an example? An anthropologist would counter and say, it doesn't matter how many times you survey a population, that survey itself is, a, let's say, a construct developed by outside researchers, and you're really kind of just getting like a survey back that is based on the questions that you're asking. It doesn't really allow for that multifaceted and multicultural, in a lot of senses, sort of responses and that rich level of detail you get from qualitative data. Now, that being said, anthropology also works with quantitative data, and public health, as I mentioned, also works with qualitative data. So the barriers that kind of arbitrarily separate these two disciplines are started becoming a little bit eroded, or at least more permeable, especially in cultural and medical anthropology, and especially in, let's say, feminist or socio-ecological public health that seeks to be holistic, remember, basically all-encompassing, which really is what anthropology tries to do. So in a lot of senses, public health kind of borrows from anthropology. So for instance, syndemics theory is a theory about diseases, and for instance, that you can't just look at a single disease in isolation because multiple diseases are oftentimes spreading around in a certain community. Public health kind of borrowed that term and kind of made it their own, as an example, to the sort of frustration of the medical anthropologist Merrill Singer that kind of developed it, because he claims they're kind of using it wrong in his term of how it should be used, as an example. And anthropology also has borrowed stuff from public health. So for instance, photo voice, which I mentioned earlier, largely developed as a public health and feminist sort of theory and practice model to be able to engage with the community. Oftentimes also public health and anthropology will use certain terminologies that basically mean the same thing, but they have different histories. And they get kind of annoyed when you say, oh, this is just this. Public health, for instance, loves models and theories that sort of explain human behavior. An anthropologist is generally more uncomfortable with models and theories, but oftentimes those models and theories are based on anthropological sort of understanding and knowledge. They're just operationalized differently. I would also say, to be fair to public health, too, another critique of anthropology is that in its history, it's been very much focused on critique and criticism, let's say, of public health, saying you're being problematic because you're not understanding that local context and you're kind of just doing an intervention. Let's say you were trying to promote food security in a community. So public health practitioners are going around giving everyone food stamps, as an example. But as I mentioned earlier in a long time example, what may end up happening is because the public health doesn't do their due diligence and kind of ask around the community, hey, would you even use food stamps? What may happen is the community doesn't want to use them because of the stigma attached to using food stamps, as an example. Anthropology would say, hey, you need to make sure that you have an understanding of what to do before you go starting to try and change things in a certain community. You're not sure of the consequences of that happening. That's the anthropological sort of understanding of how public health operates. They kind of have a one-size-fits-all model and kind of just shove it at certain problems. On the other hand, public health says, well, for very pressing issues, you can't just do research for years before coming up with a potential solution, because people might be suffering during that whole time period of you kind of being uncomfortable with kind of just going out there and doing something. So public health is usually a more pragmatic, more timely framework. So for instance, with Ebola virus in 2016, 2014 roughly, for the most part, public health practitioners were kind of the boots on the ground people addressing the issue. Same with Zika virus, as an example. When Zika was kind of spreading rapidly around the globe, anthropology was very slow to produce scholarship on it and quote unquote do something, because the discipline is largely and classically kind of uncomfortable with doing sort of rapid interventions. This is starting to change, however. There were scholars doing so-called rapid assessment ethnographies, as an example, which for some people is kind of a dirty word almost, on Ebola virus or on Zika virus. But rapid assessment ethnography is a great example of how you can kind of synthesize public health and anthropology. Now, this terminology of rapid assessment ethnography basically means we're going to do a sort of quick and dirty, very intensive ethnography. So I'm not going to spend 3 years in the community. I might spend 3 weeks in the community and kind of get my boots on the ground, kind of see what's the problem here, what can we quickly do to address a problem. You still get that qualitative data, it's just not as long-term rigorous as traditional anthropology, quote unquote, but you're able to actually go out there and make some impactful change, as an example. So you can kind of think about that also when you're thinking about your intervention papers, because probably you're not going to have a long time realistically to do a certain intervention. Of course, these interventions are just proposals, so if you want to do a long-term intervention, you can, but just know oftentimes interventions are very costly, and that applies both to the time and also the monetary cost. So if you only have, let's say, 3 months to promote diabetes education awareness to reduce the rate of diabetes by eating more healthier food options, what can you do in 3 months? It needs to be quick, it needs to be efficient, it needs to be culturally salient and relevant to them to be able to say, okay, sure, I will do that, or I'm able to do that, as an example. Now, anthropology and public health, as they're starting to kind of get more comfortable with working with each other, are also starting to have degrees in both. So as an example, there are multiple professors in the Department of Public Health at USF and also the Anthropology Department at USF that have degrees in both public health and anthropology. Additionally, a lot of graduate students, including myself, are getting a PhD in anthropology while also getting a master's degree in public health. So there's a new generation of scholars almost started getting this more interdisciplinary, more holistic education to be able to work, let's say, at the CDC, or to be able to work in an academic setting in either the public health department or the anthropology department. So I think this is a great benefit of the program at USF, but also of the larger trend of the disciplinary boundaries starting to kind of get eroded, or at least more permeable over time, because there are lots of good things and also a lot of weaknesses of both disciplines, of all disciplines. And having that more encompassing perspective may be a way to strengthen either of them in the process. The article I assigned to you on the mobile food pantries in Tampa is actually a great example of how public health and anthropology can sort of be integrated on the ground, what we often say in at least anthropology. Basically, what can be done in the local context to better, let's say, strengthen a program that already exists. That's a great way anthropology kind of contributes to public health, saying, hey, like, we see you're doing this, here's how it can be improved, or this is something that is a sort of limitation or weakness of what you're currently doing. How can we go about addressing that? And oftentimes it's just talking to people, and that's sort of what anthropology brings to the table. Now, I have a quote here that says, data from this project show that there is a high rate of food insecurity, basically people feeling that they do not have adequate, timely access to nutritious and cost-effective foods among mobile food pantry users in Tampa Bay. Now, a mobile food pantry basically is a temporary location where individuals in a certain community can show up and access foodstuffs either for free or at a reduced cost. What this looks like often in Tampa Bay is there's, like, for instance, a community center or a church that kind of hosts Feeding Tampa Bay's mobile food pantry. Feeding Tampa Bay arrives with a bunch of sort of boxes full of different foodstuffs and goods, and then people form a line, and over time they are given a box of food. And then with that food, they can go home, they can cook it, they can prepare it, they can eat it if it's dry goods, as an example. And it's a way to sort of offset or alleviate food insecurity in a given community. Now, among this population, the question is often not whether food assistance or government assistance services exist, but to what extent they can be accessed. There are multiple food assistance programs. There's WIC as an example, there's CHIP as an example, and also there are certain organizations that also provide offset costs for foods or free foods as an example. The issue often is a lack of knowledge concerning the services that are available, and also access to such services. For instance, transportation often is found to be a barrier for food insecurity, because if people can't even go to the grocery store without having to walk or use public transportation for a few miles, this is a big barrier for them in terms of their ability to access food on a timely and cost-effective basis. Because also, when you're thinking about cost effectiveness, you can't just think about the price of a certain good. You must also think about the time cost of, let's say, getting off of work early to go to the grocery store, or having to take care of your kids and also go grocery shopping, or take your kids to school, as an example. So there is also the time and economic costs, which were kind of tied together in terms of food, that often shapes availability of food services too. And additionally, if, let's say, you are a refugee or a migrant, there's a lot of those actually in Tampa Bay, you may be very unfamiliar with the services that are available to you. They may not even be written or communicated in your primary language. So what do you do in that situation? This kind of applies back to the Mahoney reading you had a few weeks ago about the refugees from the Congo. If you're not able to know even how to read, let's say, a street sign, or interpret how to get to a certain building, how are you expected to be able to sign up for CHIP, to be able to sign up for WIC, to be able to get food assistance services? And additionally, this gets very complicated when you're talking about public health, because food insecurity, so let's say you're under or malnourished, is a risk factor for a variety of different chronic conditions, even overnutrition. So let's say you are utilizing a lot of fast food services because it's cheap and it's close to your home. That can increase your risk for obesity, type 2 diabetes, high blood pressure, which are very much public health issues and concerns. But there are also concerns for anthropology. Anthropology also looks at health oftentimes, especially for medical anthropology and also cultural anthropology as an example, or biological anthropology too. Now, how can these two disciplines kind of work together? And the answer to that is in a lot of different ways. There's not one kind of magic bullet answer to that question. Again, anthropology is very good at talking to people. In public health, generally, while they do often do interviews as well, they most often are doing quantitative surveys, because you can get a wider sort of net thrown out to be able to get an understanding of what's going on in a community. However, if you survey a bunch of people and you're asking them, hey, are you food insecure? Or, hey, are you able to afford food? they may say, let's say, for example, yes, I can afford food. But there wasn't a question asked that said, are you able to spend time off of work? Are you able to go to the grocery store? Do you have access to transportation? If those questions aren't asked because you didn't think to ask them, or you didn't ask, hey, what are some barriers to that might shape your food insecurity, you may have an unclear picture and say, oh, they're food secure, they're able to afford food, we don't need to provide for this community. An anthropologist that might go into the field might see, okay, they can't even access the services. They don't know they exist. So if you're asking them, are you accessing food security services that they don't even know exist, they're going to say no, right? But how can we get them to use such services is a good way for anthropology to turn to applied work. Okay, public health is seeing a need here. How can anthropologists sort of contribute to this discussion? So that could be trying to persuade policymakers to provide access to transportation services for food insecure households. It could be to talk to community members, say, hey, what do you think would make it easier for you to be able to afford healthy foods? Hey, if there was a grocery store here, do you think you would use it? Those are questions that anthropology can ask that kind of supplement almost public health, what they're doing. That's just an example. I'm also, of course, oversimplifying. But that generally is the role anthropology plays in a multidisciplinary team. They're the talkers, they're asking questions, and they're kind of filling in the blanks that may be lost in the shuffle of a survey, as an example. All right, so I'm not going to take too much of your time today because, again, this is supposed to be a workshop day for you on your reflection paper. So because I can't do this in person, I'm going to basically outline what you should expect to be graded on. So if you look at your syllabus, basically I have broken down that paragraph on the reflection paper into 4 bullets here. Think of these 4 bullets as the rubric I will be using, assessing how well you did each of these. So concerning the first, does your paper meet the quality standards I expect from you in this class? So I outlined in the syllabus the page length I am asking for, as well as the font size and the font you should use, so Times New Roman 12, for instance. And of course, if it's late or not. So this is the basic, what you've probably seen for a lot of your papers in the college setting. Basically, how well is the writing quality? Now, the meat of this paper, and which will be weighted more, is did you deeply reflect on at least one issue of interest to yourself? So this paper is, because it is about your own positionality and your reflexivity, a subjective paper. So don't think that I'm going to be super stringent when I'm grading this in terms of do I think that this is true or this is your reality. What I'm trying to get at here is what do you think is important to yourself? So you're going to reflect on an issue that you think is important. If you think that food insecurity is important, why do you think it is important? Express that to me, essentially. This could be because you yourself are food insecure. It could be because you are concerned with others being food insecure and you want to be able to do more. And maybe that's why you're even in college, try to get an education, for instance. So think about that, and also in terms of what's your positionality related to that topic. If you are not food insecure, for instance, but you're talking about food insecurity, what privilege do you have that is allowing you to not be food insecure, but still be able to do your research on this topic? Is it because you come from an affluent family that never needed to worry about the next meal? Is it because you volunteered at a food bank one time? Is it because you are concerned with racial disparities concerning food insecurity? All of these topics, I'm mentioning food insecurity because, again, I like to latch onto it because I think it's very tangible for everybody. But think about how your own positionality, so that could be, as an example, this is a very exhaustive list it could possibly be, but to pull from some of them, it could be your perceived race or ethnicity, your gender, your economic status, your education status, your sexuality. Depending on your topic, different issues are going to intersect with each other differently. So I said in the syllabus that you should reflect on at least one issue of concern to you. Because in this class, I've talked about in great detail that a lot of issues can't be seen in isolation. They are intersectional. You can't look at gender issues often without looking at also racial issues. This applies to a lot of different scenarios, and think of it as a way to enrich in the data you are collecting, because there's always another facet or detail that you could be including. And not including that is detracting probably from the overall quality of the piece. You being able to reflect on your own positionality is what strengthens the research, because you can say, for instance, I understand that I am ignoring, let's say, gender when I'm talking about racism. There's going to be some concessions here because this paper cannot be exhaustive, but I understand based on the literature that this is also a very important issue. So you don't need to cover every single thing, but just be able to say, hey, I'm a white cisgendered male talking about reproductive justice in a context where it predominantly affects women. So my perspective is going to be different from that of a woman. That's what you're trying to do here when you're doing a reflexivity piece. Now, to be able to understand what is currently being said, you need to also look at the academic literature, which is why I'm having you cite either 4 academic articles. They could be either from this class or outside of the class, or you could cite some of the chapters or other reading materials I've given you throughout this semester. But at a minimum, I want 4 academic sources. They can be from chapters, out of books, they could be academic articles, but again, they do not need to be from my class. They can be from outside the class as long as they are relevant to the topic in which you are trying to engage with. So you will recognize this slide hopefully from 2 weeks ago, but I want to harp on it again since this paper is due very soon. So the importance and reason behind being reflexive is that you as the researcher, as an anthropologist or as a field worker, you are the research tool. The notebook is an extension of your own thought process and that of your participants, but you are the one doing the recording. You're the one asking the questions. This is important because, as we talked about in this class, humans are not objective beings. So because we all come from different backgrounds, we bring certain things to the table that may end up biasing the research and most likely will bias the research. So objectivity is compromised almost always when you're doing this sort of research, which is why you need to be able to reflect on your personal biases, your own personal positionality, in order to say, yes, I am a white male researcher on a reproductive topic. However, because of that, I have a different perspective than someone else doing this research on this topic that has a different positionality than me. So it's not always a negative thing to say, I am hindering the objectivity of this research by being who I am. It can be a positive thing by saying, I bring something else to the table that wouldn't be possible unless I was critically thinking about my own position related to this topic, which is why I'm having you do this paper. Now, in terms of participant observation, your viewpoint itself is going to alter what you ask and how you perceive things. So think about this when you're doing your intervention paper. How does my own positionality, my own stake essentially in this topic, influence A, why I'm even doing this sort of intervention, and B, what I want to get out of it, either for myself or for the participants. So self-reflexivity has become central to understanding the impact of a wide variety of intersectional topics, including gender, sexuality, ethnic group, class, etc. So keep that in mind when you're questioning possibly like, what's the purpose of this paper? The purpose of this paper is to get you to really think about yourself and the role of you as a member of society, as a member of a multicultural society, more importantly. So returning to the definition again, you can think of self-reflexivity, also sometimes just referred to as reflexivity, as a critical self-examination of the role the anthropologist plays in research and an awareness that one's intersectional identity affects one's fieldwork and analysis. So sometimes anthropologists or other researchers will conduct a reflexivity piece before they even go into the field. Let's say they have a new topic of interest to themselves. They've been doing, use me as an example, Zika virus in Belize research. But let's say I want to look at COVID-19 in Tampa Bay, Florida. My positionality is going to affect my research in different ways depending on the context in which I'm doing the work in. If I'm in Belize, I must take into account that I'm a white male foreign researcher, and there's a perception that often goes with that I have more power than my participants, because maybe there's this perception that I am better educated, as an example. So when I tell people I'm a medical anthropologist, that medical term actually has a lot of weight when I go to Belize, because there's not really an anthropology program in the country. So they hear medical and they assume that I'm a doctor, or maybe I'm a training to be a doctor. So people will start to ask me, should I take this medication, or what should I do if I experience a rash? Like, is it Zika? I have to tell them that I can't ethically answer those questions because I'm not a medical doctor. I'm an anthropologist. I study people, but I'm more focused on how culture and medicine interact with each other. I'm not a medical doctor. So what I can do is I can show them, for instance, resources such as the CDC or the WHO that have a better and more powerful ability to make clear statements about certain issues. Now, when I go to Tampa, let's say I'm doing COVID-19 research again, in this example, me being a white male foreign researcher may have less weight, especially if I am interacting with, let's say, biomedical doctors that are predominantly white males. My positionality may actually be lower in terms of power than them, because they may perceive me to be a qualitative researcher, in which medical doctors often perceive qualitative research as lesser than quantitative research. So I may be, if anything, an annoyance, or I may be perceived as something that is getting in the way of them trying to do their work. So your reflexivity, your positionality is going to have an effect on the fieldwork, but people's perceptions of you are also going to have an impact on the fieldwork. And if you aren't aware of that or thinking about that when you go into the field, you may end up going in a different direction than you had anticipated because you didn't critically sit down and think about what could possibly happen or manifest when I go into the field based on how I look and how people perceive me. So I keep mentioning the field, however, that's just because anthropology often uses this term to refer to going out and doing things or doing research. But of course, your own positionality is going to have a large influence in the greater US population for how people interact with you and perceive you, their expectations of you. So whether or not you are thinking about it, let's say you don't critically think about your own positionality and reflect on what that means to be a member of the US society given who you are, people are going to make their own assumptions based on how you look, how you talk, your education, maybe your work experience, etc. Maybe even how old you are, as another example. So keeping that in mind, it's important to reflect on, especially if you are in a position of perceived authority or power. Let's say you have a high education and you are a white male, such as myself. If I don't reflect on that position and the power and differentials that can occur, whether perceived or real because of that, I may inadvertently say something that is an example, could be a microaggression, or it could be something that is much more than a microaggression, to give another example. So it's important in the sense that if you don't reflect on it, people are still going to make assumptions based on how you look and how you behave. But if you do think about it, you can more critically take a better position, or maybe even call out others who are not being critical about their own positionality, because you've sat down and you have thought about it. So this exercise is focused on an issue of relevance to you, but also think about how this can reflect back on you as a mirror to say, okay, why do I care about this topic? Why do I not care about another topic? For another example. So if you're focusing on food insecurity, but you don't mention gender in your reflection paper as a topic that intersects with food insecurity, why did you not mention gender? Was it because you're to use my own experience, let's say you are a cisgendered male. Maybe you just didn't think about how the experience of a woman would be different from that of a man because you've never stepped in the shoes of being a woman. So it's not just about yourself, it's about what makes you not you also. What do you care about? Why don't you care about some topics? So here basically is a short outline, and I'm going to actually expand upon these in the subsequent slides. But also you can find a document concerning your intervention papers both in the modules but also in the Files tab of Canvas. Remember, I'm always urging you to check out that Files tab because that's somewhere a lot of your really relevant documents are in this class. So make sure you familiarize yourself with these guidelines. This is for the intervention paper. Remember, that's distinct from the reflexivity or personal reflection paper, and is actually the last assignment of this semester. It hopefully is sort of a culmination of everything, as I discussed last week, that gives me a clear understanding of what you took out of this class and maybe what you actually want to do outside of the university setting or outside of this classroom, as an example. I'm going to go through each of these 7 bullets briefly because I want to make sure that you all really understand what I'm trying to get you all to do. So, and also the fact that this is not necessarily hard. It's just spend a little bit of time on this. That way you know that you are in a good place, essentially. So when you're looking at your chosen topic, you must also understand what's already been done. What is the literature, essentially? So as an example, if you are trying to find out what's been done on food insecurity, you may want to go on Google Scholar or USF Library's website and type in food insecurity anthropology. Likewise, if you're looking at mental health, you may want to type in anthropology of mental health. I'm not going to restrict you to anthropology, however, I would encourage you to do so because you're going to see a lot of the same concepts throughout the course that I've been trying to instill upon you, such as structural violence, such as intersectionality, just topics that we use interchangeably when we're talking about certain issues. That way we all have the same language to convey, let's say, our intervention proposal to an audience. Since I am the audience, I'm going to be most familiar with anthropology literature, so I'll have a better idea of what you are trying to convey, which is what would happen if you actually did an intervention proposal in the quote-unquote real world, because the reviewer that would be chosen most likely may be an anthropologist if you say you're looking at anthropology theory, because the editor of whoever you're trying to propose the project to will try to find someone that is knowledgeable on your topic. Now that being said, because I know there are some people that have never searched for articles on the USF library, which is why I also had you do this independently a couple months ago at this point. If you have any questions, please feel free to reach out to me. I can point you in the right direction. I can help you find resources or articles. I'm looking forward to seeing what you come up with, and I want to make sure that you don't feel like you are being frustrated by or lost by trying to navigate these convoluted, admittedly academic systems in which we get used to having to deal with when we're trying to find academic literature on given topics. Okay, so the next step, and I want to preface and emphasize next step usually for a research project after you conduct a literature review is to formulate your research questions. Usually this is an iterative process, and remember research questions or RQs are meant to sort of be adaptable and malleable. You likely when you're in the field will realize, okay, this question doesn't really fit, or maybe I should be asking this instead, and that is completely and perfectly viable as a research methodology. Best make sure that you record that. Let's say you're actually doing a project. This is an intervention proposal, so you're not actually going out and doing the research, but just so you know, if this was an actual applied setting, this sometimes can happen, and actually, but probably more often than not, it does happen, especially when you're just starting off, I would say. So You conduct your literature review on a chosen topic, let's say food insecurity. Then you develop generally 1 to 3 research questions. You don't want to go more than 3 as a general rule of thumb, just because that can sort of get complicated and it's hard to make sure you're doing an adequate job of addressing the questions and answering them essentially. So usually I would say 2 or 3 is the average, but if you have one specific thing you're looking at, one also is a viable sort of method. But I would push or encourage you to at least have 2, sort of what I'm looking for. So that being said, make sure you please mention your research questions in your intervention proposal. I'll be looking for that, and you will be graded based on my assessment of if this is included or not. So next week's assignment actually literally is just to submit a draft of your research questions. There's no wrong answer here, and I'll probably give you feedback saying, hey, you might want to look at this instead, or this is really interesting, this could be expanded this way. That's what would happen if I was, for instance, collaborating with you on a research project. It's a process of back and forth and kind of figuring out what works, basically. So a good way to frame a research question is directly after your review. So you conducted your literature review, let's say on food insecurity. You realize, okay, I think this is really interesting, but they're missing this. Why don't they look at this? Make that a question. That's literally it. So if you want to look at food insecurity, you could say, how do community members in Tampa Bay perceive the role of mobile food pantries from Feeding Tampa Bay? Do they think that they are adequate? Do they think that they could be doing a better job at servicing the community? These are follow-up questions that you can ask based on that initial question, if that makes any sense. Another key component of your intervention proposal is, well, why is it important? If the reviewer is not sure of its importance or does not think it's important because you did not convey its importance, they may not find it grounds to justify them giving you money. So this is a very important component to have in your proposal. So justify why an organization or a grant agency should give you money. So why is addressing food insecurity a crucial and necessary topic of concern right now? Why should we address coronavirus right now? Why should we address climate change right now? Once you have that importance down, you need to discuss what are you doing to be able to address it in some way. So what is your methodology? If you're looking at climate change or coastal erosion, what are you doing to assess people's perceptions of climate change and maybe their ability or their want to make a positive impact on their environment? So you may want to do interviews with local residents by Clearwater Beach or wherever you're doing the intervention at. Or you may want to do surveys of Tampa Bay residents in flood zones because you want to see what is their willingness to, for instance, change their buildings structures to apply to newer codes, even if they're grandfathered in. Would they be able to do this, or do they need some sort of cash assistance to be able to change some aspect of their property, as an example? So you need to convey why it's important that you're doing this project, but also what you're doing in this project. Where you are doing research is just as important as what you want to do in your research. So ideally, I would pick one location to do your intervention. As an example, you could look at Feeding Tampa Bay Food Pantry. Let's say you're looking at the perceptions of food insecurity and access to services for minority populations. If you pick too many locations, let's say a food pantry and a community center somewhere else in Tampa, your methodology is going to have to be a lot more intensive because you may need to do different things in the food pantry than what you're doing at the community center. You may need to do a different methodology. You may need to talk to different kinds of people. This can make your proposal really messy, and the reviewer may think that you're trying to do too much. Now, you can do a multi-sited intervention. I'm not saying don't do it. I'm just saying that it's going to get really complicated. So it's a good experience to have being able to convey why it's important to look at different locations. But also keep in mind that an anthropologist would also say if you don't spend enough time at one location, you may get lax data at two locations because you didn't spend enough time to get that thick description. You didn't build rapport, you didn't talk to a lot of people in one location because you chose to do 2 or 3 locations. As an example, when I was proposing my master's thesis, my advisor said that me going to 3 locations was probably too much for a master's thesis. I didn't have enough time. So I ended up picking one location, Keycocker Island, where I stayed there for 4 months, as opposed to splitting up those 4 months by going to 3 different locations, so roughly like a month and a half at each. That wouldn't have given me good data. I needed to spend a long time in Keycocker to understand what really is going on there concerning Zika virus. But also consider if the location that you are picking makes sense given your research questions, because that may mean you need to either change your research questions to fit the field site or vice versa. So if you're looking at food insecurity perceptions in Feeding Tampa Bay among volunteers, you may get different answers than if you talked to, let's say, community members who don't use the food bank. So make sure that your research questions make sense. If your research question is, what do community members perceive to be a barrier to food insecurity, but then you go to the food pantry and you're only talking to volunteers there, this may give you a biased or unrealistic reflection of the reality of food insecurity for community members. So number 5 on the surface seems kind of similar to number 4. However, what it really is doing is building off of parts 1 through 4 to get at really what you are doing. So you established your place with number 4, where you are going. Your activities are essentially your methodology. What are you going to do when you get to that place? The individuals you need to target, they're called a target population, are those that you intend with doing the intervention on and or for. What are you collecting research from? So if I'm in a clinical setting, my target population may be the doctors and nurses in that community. They may also be the patients trying to utilize these services in the community. How I talk about a certain topic, let's say Zika virus, with a doctor is going to be different, most likely, from that if I was having a conversation with a patient in their clinic. So I may need to have a different interview guide or questionnaire for the doctors than I do the community members. Additionally, I may need to get access from the doctors to be able to allow them, or them to allow me, to be able to talk with patients in this clinic also. So the reason I may speak to doctors, nurses, and patients is to get at what's called the triangulation of the data. I've talked about this term before, but as a recap, triangulation basically just means that I've taken multiple different data sources. So I've gotten the perspectives of doctors, gotten the perspectives of nurses, I've gotten the perspectives of patients, and I've tried to see what they're all saying about Zika, which will give me better, richer data than if I just talk to the doctors, because their experience is going to be different from that of the community member. So anthropologists try to speak with multiple different key stakeholders, different individuals that have a stake in a certain topic, in order to bring all these different perspectives together, to triangulate to them towards a conclusion, that conclusion being the maybe result of your intervention or the efficacy or effectiveness of your chosen research topic. How well can I argue this is reality for participants when I go to the field? How well can I argue this intervention will work when I am presenting my results to a review board or the community members themselves as an applied component of my project? The next step after developing sort of the skeletal framework of your project is to sort of formulate, okay, how much money would I realistically need to be able to do this? Now, I'm not too concerned about budgets, and I haven't talked about budgeting in this class. That's more of an advanced thing you have to worry about. Like, for instance, in my public health graduate level classes, I often need to develop budgets and sort of justify the cost of a certain program as an example, or to assess why they asked for this much money and if that actually reflects what they actually were doing, essentially. So a researcher that is often in the position of being a grant reviewer. And they will say, okay, well, based on my experiences, it makes sense they're asking for this much money. That generally is just a process, just so you know how this works. Now, additionally, that being said, we're just going to go ahead and say that you roughly have $200,000 for this project. You may not need virtually any of that for what you have in mind, or you may think it's not enough money. What I'm trying to say is, repeat the lines, I am not very concerned about your budget. I'm more just concerned with you having a clear idea of something that you would like to do that could positively have an impact on a certain community or a certain cultural practice or a certain, let's say, environmental issue of concern to you. Now, also for your purposes, you most likely will only need qualitative and or quantitative methods in software, let's say as an example, to conduct your analysis. So do a quick little review on qualitative and quantitative analyses software packages. I have some examples here. So for instance, NVivo and IBM's SPSS, these are ways to basically analyze your data. If you don't want to use software, and actually a lot of the old school anthropologists don't, you can just say you're doing thematic coding, so looking for patterns as an example, and interviews and transcripts from people talking with you. Now, if you need a refresher on that, you can go back in the previous parts of the semester and look up basically qualitative versus quantitative analysis that I mentioned before. Or, of course, you can always talk to me about it as well. Now, again, not super concerned about the budget, so don't be super concerned about the budget, but just have some mentioning there saying this project will roughly take X amount of money. Just so you know, generally in anthropology, at least the traditional anthropological work, we really can't justify asking for that much money, especially if it's medical or cultural, unless you're doing biological stuff. Because, for instance, when I go to Belize, I'm really only paying for flight and room and board and, well, food. And that's about it. I kind of just walk around and talk to people. So anthropology generally doesn't get a ton of research grant money unless you're doing a project, let's say with public health, again, bringing in the earlier part of the presentation, or if you're working at for instance, in a biological setting, as an example, or you're working for the EPA or the NSF, essentially, doing different kinds of large-scale governmental projects that have a lot more money to kind of throw around, essentially. Well, at least they used to. We'll see what the future looks like now. So keep that in mind. Again, not really super concerned about the budget, but just know that it's a bullet and it's something that I'm going to be looking for in your intervention paper. So the next step after finding your budget, which should also inform your analysis strategy, again, with for instance, the IBM SPSS package, is how do you plan on analyzing your data? What I often do, and I probably would suggest you doing this just because I think it's pretty straightforward, in qualitative data at least, is called thematic coding or coding for themes. I talked about this briefly probably about a month ago, if not more, but thematic coding essentially is you going through all of your interviews and finding themes and sub-themes on a given topic. Let's say you're looking at gender relations in Keokuk or Belize, and you're talking to men about their experience with being a man and what that means to be a man in the context of an infectious disease that can spread sexually. They may mention that they don't like using condoms. So if many guys are saying that they don't like using condoms, you may have developed a theme, which is condom use practices, or the lack of condom use practices. This is just an example. So think about how your respondents may answer your questions and what themes or sub-themes may develop. You don't need to guess in this intervention proposal. You're just saying that I will code the data using thematic coding, looking for themes and sub-themes as an example. In terms of quantitative analysis, again, you don't actually need to run anything. You're not doing any actual analysis. You're just saying what you would do if you were doing a proposal. So just very simply, very bluntly, you can just say, I will look for statistical significance in responses, looking for an established pattern or a norm, which may tell me that this is actually what is happening in the field. Again, I want to stress you're not actually doing the research, it's just a proposal. So don't stress too much about what you plan to do, just think about what makes sense given my topic, given my research questions, given my methodology, and what kind of data I'm going to be able to get if I were to do this project as an example. Think of those 7 steps that I just gave you as the structure of your intervention proposal. So as I mentioned a few weeks ago, you can even take each of those 7 bullets and basically make a header out of it, with the addition, of course, of a references cited or bibliography when you cite sources. That being said, I am going to be assessing how well you did those 7 steps with this rubric of 7 points for my evaluation, essentially. So I'm going to be looking at number 1, how well do your research questions get at what you are trying to do with your methodology? Is your literature review supporting your proposed research questions? Does it make sense that you're trying to do that? Do I think it's important for you and your intervention to answer those specific questions? Now, number 2 is that literature review. Do you have a good understanding, do I think you have a good understanding of the literature given a certain topic? Is your literature review supporting your claims that it is important to look at food insecurity, as an example? Now, when you're looking at number 3, your research site, does it make sense to me that you are going to this location to answer your research questions? So does it make sense that you are going to a food bank to answer the questions you propose, as an example? Now, number 4, the theory or the framework you're using, think of this in terms of the theories we talked about in this class. So structural violence, structural racism, those are what I'm going to be kind of looking for, but if you find others from the class, fantastic. I'm looking forward to reading what you come up with. Also, if you find anything in the literature that you think is important, so if there's something that I didn't talk about in this class, but you think is mentioned a lot in the literature, again, taking food insecurity, often the new term being used is a food swamp instead of a food desert. So you can explore the concept of a food swamp and what it means to live in a food swamp as a theory. So have at least 1 theory or 2 theories that you can really work with, because as a reviewer of a proposal, I'm looking for, do they have an understanding of what's being done already and what theoretical perspective are they using to operationalize their research questions? Are they coming at this from a feminist perspective? Or are they coming at this from a structural violence or neoliberal perspective? These are the kind of things that you should be thinking about when you're formulating your proposal. Now, in terms of your methodology, does it make sense that you're interviewing this amount of people and these types of people? If you're looking at food insecurity, I need to know why you're talking to, let's say, the volunteers and not those in the community that actually are food insecure. This is just an example, but try to think about what I'm going to be thinking when I'm reading your proposal. Does it make sense that you're interviewing these people? Does it make sense that you're providing surveys to this amount of people? That's what I'm going to be assessing when I'm reading your intervention. Now, of importance to me, or probably more of particular importance to me, are the final 2 bullets in black that I've added to DeWalt and DeWalt's framework. So going off of your reflection paper, which is due before this project is due, did the researcher reflect on their own positionality and how that can influence what you are expecting to find? If you don't mention your reflexivity and your positionality, as a reviewer, I may not know who you are, or I don't have an understanding of who you think you are. So I may not know where you're coming from or why you're doing this certain topic. This is important because, again, unspoken biases, just as spoken biases, can influence and bias research. So I need to know what you're bringing to the table, so I have a good idea of how you intend to take this paper in a certain direction. This doesn't need to be long. most times a positionality or reflexivity chapter, or sorry, paragraph is about a paragraph. So just think about what role you have as a researcher. So using me as an example again, what does it mean to be a white male researcher looking at a reproductive topic, and what levels of access am I probably going to have a hard time getting into? So is it going to be difficult for me as a white male to interview pregnant women about the stigma they experience with getting an abortion, as an example? These are the kind of topics you should be thinking about when you're doing an intervention. And finally, is this proposal ethical? So I need to know that you have a firm understanding of ethics. For this class, since I've shown you the AAA Code of Ethics, which is again below here on this link, I would suggest going through that and making sure that all of the ethical guidelines that are written here are, if not being addressed, are not being violated. So I need to know that, for instance, that you're not lying to participants, because the anthropologists, as an ethical guideline and stipulation, do not lie to participants, no matter what. So keep that in mind. So try not to be subversive, meaning you're not trying to dupe or trick participants into doing or saying anything. Also, are you being fair and equitable when you're giving out, let's say, any incentives in your research? So go through that list. You don't need to say, I'm going to address stipulation 1 of the Code of Ethics. Just, I need to know when I'm reading that this paper does not seem unethical. So keep that in mind.